from Somerset, Kentucky. Good morning, Doctor.
Good morning, Jack.
Well, bring us up to speed. Any kind of news over the weekend regarding the coronavirus?
Well, two major things. One is that it does look like nationally our rates have flattened or slightly dropped, which is very, very good news. It means our social distancing, staying at home, is paying off. The other news is that we do have now a plan, or at least an outline of a plan to open. And one of the major things that we need to see is a dropping in rates for 2 weeks. So we still have not seen that in Kentucky. We have not dropped. And I think in Kentucky, one of the things that you're going to witness is that because we have suppressed our rates so low, that it will be hard to determine a drop. So in other words, we're not going to have a big peak that will suddenly drop off. So we may be a little bit delayed in reopening, but we're certainly been very, very safe as far as a comparison to the rest of the nation. And the governor is just doing an excellent job. Again, I have said this before, we do need to follow his advice and the advice of the health department.
Are you feeling pretty good about how the whole thing is playing out, how the president is leaving it up to the governors and then criticizing the governors for not actually criticizing the protesters for protesting? Anyway, how do you feel about it?
Well, I do think that is good, but we do need to have messaging. Some of the tweets were somewhat disappointing. I do think the protesters need to settle down. It will be a self-fulfilling prophecy for them. If they get out and protest and spread the virus around, they'll make the situation worse where we possibly can't open up until later. Hopefully the protesters are from a very, very small fraction of the people out there. It's just like the one church we had, one out of how many thousands and thousands of churches that is still holding services. And I am very fearful for that church that they may get ravaged by this virus. As I've said before, churches are an extremely dangerous place to be in. It's close quarters, and the singing tends to aerosolize the virus. So they actually have a unique activity which spreads the virus and makes it even more dangerous. So if you're going to have a church service, do it virtually, do it in the parking lot, and do it safely. And I think part of worshiping God is to respect others and to try to keep others safe. And so that certainly should be something that's followed.
My understanding is, I'm no historian, but my understanding is that the Spanish flu epidemic or pandemic in 1918, folks did basically what we've done and stayed inside, and then when we got to a point, they all decided to go back out again, and then we got hit with a second wave that was much worse than the first.
That's correct, and that's what happened in the Spanish flu epidemic, and hopefully that won't happen here. People need to realize that this infection has not run its course. In other words, this is a peak, and it's starting to go down from the peak due to social distancing, not due to a herd immunity or that the infection is starting to burn out. So it's kind of artificial. And unless rates get very low, where we can do case tracking, the peak will just come back if people let up in any big degree to social distancing. And that is one of the things that, to just stress again, is that when you're out shopping, please wear a mask. Walmart's now requiring all employees to wear masks. Of course, we've talked about Whole Foods that's requiring everyone to wear masks. And that's just basic courtesy. And it's more to prevent you from spreading the virus than it is from preventing you from picking up the virus, because remember, there can be asymptomatic carriage. One of the things that really drives me crazy is when I watch TV shows of how establishments are trying to keep patrons safe, but they're not wearing masks. And that's a component of this, because unlike other outbreaks that we have seen, this outbreak is respiratory, so that masks are important. It's not like E. coli or salmonella, where washing hands and gloves are all you need to do. This one really needs to have masks worn to keep people safe. So that's what would make me feel safe about going into an establishment when the staff are wearing masks and at the same time the patrons are.
Now, Dr. Kavanagh, do you think this is going to end up being seasonal like the flu? Do you think we're going to come across this every year?
Well, I'm hearing more about that on TV, and certainly it's anybody's guess, but it has jumped to the southern hemisphere, which is not a good sign of it burning out completely. In other words, it could then come back again. The thing that I am most worried about is that when it does come back, when we do get a second wave, if it's still the same virus, because that's important for vaccine production. And from what I've heard and from what the initial results are, this virus does not mutate as fast as the flu, so I still think we're on track to developing a vaccine, and that's going to become what our optimal strategy is, and probably what's needed for us to get to phase 3 of the steps in returning to normal life.
Well, as I understand it, there were more, anti-closure rallies in some states, but the highest regarded governors in the country from both parties say it's just too early to lift restrictions without more testing available. So if they are going to indeed, in retrospect, make the decision when we open up again, you listen to Governor Beshear, and it doesn't sound like anytime soon.
Well, I don't think it's going to be anytime soon in Kentucky. Again, we've got a flat rate. We did have a huge uptick yesterday, but I think that's more of an aberration of the data. And we are going to need testing because you just can't flick a switch and say things are open. I've used the comparison of flying planes. You can fly a plane right now, the airport's open, but it's vacant. Testing is what's going to make people feel safe, and that's just starting to be rolled out. And it not only has to be testing, but it has to be reliable testing. I think you'll see that some of these tests that are coming out have not been thoroughly vetted. How can they be? It's just been weeks, not months or even years in the development. And so it's going to take a while to restore public confidence. But certainly when you talk about food handlers, talk about people working in the nursing homes, rapid testing there is key to make sure that things are safe when they come in and start their job. And so testing is going to be key, and you want to find out who's had the infection, and so an accurate antibody test is going to be important so that if a person knows that they've had an infection and that they're immune, that they can go back and work. And, of course, at this point, we don't even know how long immunity lasts. If it lasts a long time, if it wanes. So much about this virus we don't know. It seems like an eternity, but really we've only been in this for a few weeks.
Yeah, it seems like a lot longer than it actually has been since we're staying home. Always good to talk to you, and we will be visiting again on Wednesday.
All right. Thank you very much, sir.